Good morning everyone. We are group number 5 and we're going to discuss about the clinical case number 1, drugs on blood. Clinical case. A 24-year-old female had a tooth extraction. When she reached home, she noticed that the cotton balls in her mouth was soaked with blood. She changed it, but every 10 minutes, it was fully soaked with blood. She called her dentist and she was prescribed with an anticoagulant. What is a coagulant? A coagulant is a substance that causes coagulation, which is the complex process through which clots form in the blood. What is an anticoagulant? Anticoagulant medications aid in the prevention of blood clots. They are administered to patients who have a high risk of blood clots in order to lower their risk of experiencing life-threatening illnesses like heart attacks and strokes. A blood clot is a barrier that the blood forms around wounds to stop the bleeding. Anticoagulants manage this by either allowing your body to dissolve already formed clots or by stopping the formation of new clots. There are numerous forms of anticoagulants, such as injections, intravenous drugs or IV drugs, and oral treatments. Different classes of anticoagulants. The number one is warfarin, the second one is coumarin, and the third one, direct thrombin inhibitors.
So now, let's talk about their comparison according to efficacy and suitability. Efficacy. Warfarin is an anticoagulant medication often used to prevent blood clots. Its efficacy depends on factors like proper dosage, individual response, and regular monitoring to maintain therapeutic levels. For suitability, warfarin may be suitable for individuals requiring anticoagulation, but its appropriateness depends on factors like medical history, lifestyle, and potential interactions with other medications. For efficacy, coumarin is a compound found in some plants and has anticoagulant properties. However, its use is limited due to potential toxicity. Warfarin, a derivative of coumarin, is used more commonly as a prescribed anticoagulant. Efficacy depends on proper dosage and individual factors. Suitability. The suitability of coumarin or its derivatives depend on various factors like medical history, individual health conditions, and potential interactions. For efficacy of direct thrombin inhibitors, efficacy is comparable to traditional anticoagulants, but direct thrombin inhibitors offer advantages such as predictable dosing and fewer interactions. The suitability of direct thrombin inhibitors such as dabigatran depends on various factors including an individual's medical history, existing health conditions, and potential interactions with other medications.
So for warfarins, for safety, it requires regular monitoring of INR levels, interaction with food and other medications, such as risk of bleeding. And for cost, it is typically more affordable compared to newer anticoagulants. And for coumarin, it is for safety, it is similar to warfarin. It is for monitoring INR. INR levels may be necessary, and for cost, it vary. Option generic may be available. For direct thrombin inhibitors, the safety is generally well tolerated with fewer food and drug interaction. It still carries a risk of bleeding. And for cost, newer drugs may be more expensive and cost and can vary based on insurance coverage.
For the management of excessive bleeding in various medical and surgical scenarios, our recommended treatment involves the administration of tranexamic acid, also known as Hemostan. Tranexamic acid is a medication specifically designed to address instances of uncontrolled bleeding, particularly after dental procedures like tooth extraction or dental surgeries. The prescribed dosage for adult is 500 mg per capsule. It is advised to take one capsule orally after meals, 3 times a day, or as needed based on the severity of the bleeding. The regimen aims to effectively control and medicate, medicate the bleeding episodes experienced by the patient, ensuring a more comfortable and expedited recovery post-surgery or during medical conditions prone to excessive bleeding.